It's 12:05 and we will start. So good afternoon, everyone, and thank you for joining Coffee and Careers. Today we have a very special occasion as we host for the first time a notable alumnus, Dr. Wai-kit Ming, who, just like you, studied at the MPH program at HKU. So let me introduce him briefly. Dr. Wai-kit Ming is one of the youngest researchers and currently the head of community medicine at the School of Medicine and Public Health, the assistant dean of the international school at Jinan University in Guangzhou, and the adjunct professor of Yat-sen University. While earning his MD and Ph.D. at Jinan University, he earned a master's degree from the University of Hong Kong and Harvard University. Following his postdoctoral training at the University of Oxford and Harvard University, he was a visiting research fellow at the University of Oxford and the National Center for Perinatal Medicine Epidemiology in the United Kingdom. He served as the CEO of a medical device company and has 13 national patents for medical devices. As a public health physician, Dr. Ming's interdisciplinary research spans in different fields, but mostly he's focusing on population health. So right now, Dr. Ming's work revolves around COVID-19 research. He has had 2 scholarly papers published as covers of a journal and over 50 other scholarly papers published mainly in JCR, Q1, and Q2 journals. And lastly, Dr. Ming is hiring practicum interns. So if you have any questions about it, take this opportunity to inquire during the Q&A session. So we will start a discussion. It will last about 40 minutes, and then we will jump into Q&A. And without further ado, please welcome Dr. Wai-kit Ming. Thank you so much. Thank you for coming. So Dr. Ming, one of the pending questions for you, can you tell us a little bit about your role at Jinan University and what do you do?
So after I come back to China, so I joined the Jinan University. So now I'm the assistant dean of the international school, which is a little bit administrative work, for example, for the clinical curriculum design for the students, for the medical students and also other major students. And also at the same time, I'm the researcher. So that is academia. And as you mentioned earlier, so we do research and all of us will have our own team. So I have team members and also some postgraduate students. So my role is going to try to help my student to finish their master degree and also the PhD degree. So it's going to do a lot of different kinds of research related to public health. For example, the COVID-19 research, as well as the artificial intelligence in medicine. So at the same time, I also the CEO of a medical device company in Shenzhen. So I also developed some medical device which can be used in the hospital later on after we get the permission using in the hospital.
This is actually very interesting about your entrepreneurial projects. We'll get back to that. But just tracing back to how you started your career, I've looked at your first degree was in hospital management, and then you obtained your MD and PhD in gynecology and obstetrics. What motivated you to make a transition from clinical studies to public health? And can you tell us about your career journey from there a little bit? Yeah. Thank you so much.
So my first degree is not only the hospital management, but also the medical degree. So in China's system, so we have to study the medical degree in a bachelor degree. And after that, I choose to come to the Hong Kong U for my master program. At that time, I just think about as a clinical doctor, every time you only can help one patient. But for the public health research, you can help the population. So that's the reason why I would like to devote myself in the public health setting, as well as doing public health research as a clinician.
Mm-hmm. And it's something that motivated you, like when did you decide, like what was the focal point?
Yeah, so actually you still remember 20 years ago. So there is a SARS pandemic, right? So at that time, I'm the secondary school student, or we call it middle school in China. So as a secondary school student, I take the HKCE exam at that time. So everyone need to wear the mask during the public exams. So I still remember that particular situation, and totally the same right now, right? So at that time, I just thinking about if we can control the infectious disease well, and we can help a lot of people. So that's why during my study at the Hong Kong U, I choose my concentration as infectious disease and control, which is similar to the concentration right now, right? So there's a stream in this area. So at that time, I study all the very new theory and also technique from my master degree. So that's very helpful for my research right now, because I'm now doing the COVID-19, which we also use the SIR model, as well as the other modeling program. At the same time, during my study in the MPH program in Hong Kong U, I actually work as a research assistant at the Chinese University of Hong Kong in the daytime. Because as you know that most of our course is in the evening.
Yes.
So that's why I also joined the CUHK as a research assistant in health economics. So that is the first time for me as a clinician to know about what is health economics, and also do some cost effectiveness analysis. We construct some modeling, which is very new for me at that time. So I do think that the Master of Public Health program gave me a lot of opportunities to devote myself in the public health research. So yeah, that is the reason why I choose MPH, and also why I devote myself in public health research.
Thank you so much for sharing. It's very insightful, as some of our students also coming from clinical background. And as we've learned, you're also an entrepreneur. And honestly, I've seen a video of you talking about it on YouTube. And I've heard also from one of your students, Ming Gang. I don't know if you remember him. So he also shared that he has been involved in some of your projects. So can you tell us a little bit more about the projects, and how does that entrepreneurship go in line with the work in academia?
Yeah, so a long time. So in academia, so you seldom to see someone will become the CEO of a company due to two reasons. The first reason is for most of the professors, they don't have a well training on the management technique. For example, how to manage a group of people, how to do the finance budget, and all this is not the strength of the professor, right? So that's why seldom to see a successful of a professor to become a CEO of a company. But nowadays, it's a little bit different, because, for example, in China, they encourage the professor to develop their own companies in the university as well as outside the university, because most of the time when we do the research, it's just publish a paper. Okay, for most of the PhD, just finish their thesis, right? But after that, nothing, because most of the basic science research and also clinical research cannot be applied to the hospital or patient immediately. So they take a very long time. For example, 20 years, 30 years from a very fundamental basic science research to, for example, Adjunct or medical device, right? So it's quite a long time. So, but it's important for the university start to think about this, to how to translate or transition from the basic science research to the medical device or drugs, because that is the most useful for the patient. If you only publish a paper, it's useful, but not very useful for the patient. It just develop some new knowledge only. But as a as a CEO of a medical company, so we will focus different focus than the academia, because we focus on how to sell the products to the hospital, how to get the approval from the government. So all this is another techniques that the professor have to know about this. But it's very interesting for me, because over the years when I study my PhD and also MD program, I just think about we have to do something for our patient. So if we can use our research knowledge to develop a medical device for a company as well as the hospital, it should be a great thing. So that's my reason would like to join this program. So I also work with my students, as you mentioned about Mingai and also other students in the group. So we try to think about how to use the artificial intelligence in medicine. So at the time point, I also merged this research project with a public health research, because most of the research will only focus on the high income countries. Okay, so for example, you want to use the AI in high income countries, not the low or middle income countries. So I just think about because most of the doctors are not willing to go to the rural area. So if you even you pay a high salary to them, they don't want to go to there. So it's a phenomenon all over the world. For example, in Australia, seldom to have a doctor to go to the rural area to be a doctor. So they are lacking of the medical resources as well as the human resources. So I'm thinking about if we can use some technique like artificial intelligence, which can be helpful for those low and middle income country as well as the rural area to get as good as the quality of the medical service in the town or in the city or in the high income countries. So I do think that artificial intelligence may be one of the choice or one of the solution that can fix this problem. So I merge the entrepreneurship with the public health thinking. So it's not only the entrepreneurship, it's something a little bit related to social entrepreneurship. So because I'm not going to earn a lot of money, I just want to maintain the company to do something good for the public health sector.
Yeah. Well, it's very practical, you know, going way above the research capabilities. I wanted to just like the question pop up. Do you do it in collaboration with some other companies? Like I'm thinking top of my mind is Tencent. They're also working on artificial intelligence, or is just something that you independently develop?
So at the same time, we collaborate with different university as well as some company in Shenzhen. As you mentioned, in the university, we seldom have the facilities to produce these kinds of medical device because they need to have the factory, something like that, right? So for example, for my research in medical device, which is we call it OCT in doing the infertility. So we have to find a factory to produce this medical device for us, right? So we cannot do it in the university. So for this example, we have to collaborate with those existing medical device company. So we will something like the joint venture or some other collaboration methods, which is so different from the university. So, and also other research, something like the artificial intelligence, we don't need the factory. So that is more easy for us. So we only do it in the university, and also we collaborate with some other university like University of Oxford and Harvard University to get more experts to help us to think about the products which could be helpful for the population or not. And also, at the time in Boston, I tried to know more artificial intelligence techniques in the MIT as well, because as you can find resources in Boston, MIT is the best in this area. So I do think that our student, after you graduate from the MPH program, is not the end of your public health research, it's the start of your public health research as well as your career. So you can try to make use of all the resources you can have. For example, as a Harvard University students, you can have a free entry to the MIT. So you also register as an MIT student at the same time. So you can take some courses in your labor university. So nowadays we also have this system in Hong Kong as well. So for example, if you registered in Hong Kong U as a postgraduate students, you can also, especially for the PhD one, so you can also register other courses in City University, Chinese University of Hong Kong, as well as other university. You can take the course. So actually, I find someone who is from City University to join the PhD level courses in Hong Kong U. So it seems like it's for free, or just do some registration and something. So after you graduate from MPH, I do think that some of the students will go for the further training, like the PhD training, so you can try to think about how to learn, how to make use of the resources in Hong Kong.
Yeah, thank you for sharing that's very useful tips. And just as you've mentioned your experience in HKU briefly, What was the most valuable experience actually during your time at HKU, and why?
Okay. So it's 9 years ago. So the most valuable experience is I think the practicum. So at that time, I go to the Center of Food and Safety at the Hong Kong government for my practicum. So I in charge of not in charge. I participate in a research which is held by the scientific officer in that center. So I still remember the content of the practicum is and also the research is related to the salt content. That means sodium content in the food. So and that one is give me some fundamental understanding how to make use of the knowledge I have learned in the master program to become the real skill that you have to use in during your career. So that is very important for me to think about when you're sitting in the room of a lecture. So what you have to get from the lecturer or the professor. So that is the most important step for me to think about this after my practicum. So after I do my practicum, I'm quite sure that I will devote myself in the research career. So that is the most important step for myself. And also, I still remember a course by Professor Wu about the SIR model. So that is also a very important course for me to know in the infectious disease control. The SIR model could help us to estimate how many patients at the beginning of the pandemic. So that is another important point for me. When I learned this one after 20 years, and now I can use the SIR model, and with my with my insights on the cost effectiveness analysis, so I can merge two of the techniques together to trying to use the SIR model to predict the resources used in, for example, the ICU needs or isolated ward needs in Hong Kong or in mainland China. So that is also another thing that I think about is very important for my life during my time in MPH program in Hong Kong.
Well, as a practicum coordinator, I do support you that the practicum is very important and students really have to pay attention to this part. Now, if you were to go back in time and be a student at HKU again, just imagine that, what would you change from your experience? What would you take advantage of, let's say, that you haven't at that time?
I think the degree itself is very helpful for my career as well. So after I get my MPH program, MPH degree from the Hong Kong U, I can have a very broad opportunities for myself. For example, I can choose to become a research assistant at a university, or I can do my PhD or postgraduate degree, research postgraduate degree in other university, other top university. And also I can have a lot of opportunity when I go back to mainland China as a clinician with the knowledge of the research. So actually MPH give you a lot of research methodology training. So that is similar to PhD degree year one. So for example, you know how to design a research project. So we have a training on the research methodology. For example, what is retrospective study, what is cohort study, what is RCT. So all of this is similar to the year one's PhD study, so which is very helpful for our students to continue their career as a researcher. Also, most of the professors are worried about the newcomers for the research group because they don't have any knowledge in research, but our students have a very well training on that. So they are very welcome all MPH students to become the research assistant in their group, other than other background students. So that is the reason why I think about this degree give me a lot of opportunities. And also when I go back to my clinical work, I can always think about the public health issues. So during my practice, I will think about, okay, this is linked to the population. So I mainly, for example, when I'm the clinical doctor, when I face my patient, the patient will ask a question, why have to do this screening program? So screening program is one of the very important public health measures, or one of the public health policies. So I'm now very understand why we have to make this policy. for the patient. What is sensitivity, what is specificities, and what is the reason why we have to choose this screening program other than others. So, for example, some students are working on the cost-effective analysis or health economics sector. They will now more understanding why the drugs could be approved by the government. And other drugs why not approved by the government. And also, if you have some experience in the UK, so in the United Kingdom, every single screening program or medical management guidelines, we have to base on the cost effectiveness analysis. So why the doctors can choose drugs A rather than the drugs B is not only the efficacy of the drugs, is also related to the cost, because it is related to the NIH system. That means the health insurance system or health policy system. So which is also need to consider about the cost, because the government are not unlimited monies. So they have to spend limited resources in some very large populations. So that's why the MPH program can give me a lot of insight and also experience, skills that are helpful for my future career.
So you'll be happy to supervise PhD students from HKU because they're better prepared, right?
Yeah, sure.
I know, and I've read about you that is it correct that you were born in Hong Kong?
Yeah, so I born in Hong Kong.
Yeah, you were born in Hong Kong and you worked and studied in the UK, the United States, and now in China. So a lot of our students, like as they explore careers overseas or in other continents, can you give us a little overview of the working culture and specifics in these different countries that you've been to?
Yeah, so I born in Hong Kong, so I'm so familiar with the Hong Kong situation. So it's really the most effective culture all over the world is the most effective one. So people are hardworking and also skillful, and also they have a higher degree in all the aspects around Hong Kong. So it's so different from other part of the world. So for example, in the United Kingdom, so they usually enjoy their life. So after 4 p.m., you seldom to see anyone in the office. And also, if you come to the office in Saturday or Sunday, they will feel that you have some problems. Is it family problems or your personal problems while you appear in an appropriate time? So that is in the European country, they usually will think about family is the most important things they have to take care. So usually when, for example, myself, I'm a fast person. So the professor will assign some work for me, right? So as even for my visiting in the Oxford University, they will assign some job for me. So they expected I hang in every week, but actually I just use 1 hour to finish it. So I don't know why I have to wait the next week to talk to them. So that's why the speed is a bit different, but this is one of the issues that I have to mention. And but the United States is in the middle between the Hong Kong and also the UK. So they need a little bit faster than the UK, but they still enjoy their life. So every holidays, no one will inside the town. So everyone will go outside. And also for the United States, they have more different people come from other part of the world. So I don't know now, but at the time I come to the United States in the Boston Harvard University, when I work in the departments, everyone is come from different countries. So you can enjoy this multidisciplinary and also multicultural working environment. So it's similar to Hong Kong U. I think in Hong Kong U also is similar. So some staff from other part of the world. So this culture is to be similar to Hong Kong, but in China it's a bit different. They are more listen to the leaders. So if you have a supervisor in the team, so you have to listen to them because they're in charge of everything. So it's a little bit different from other countries. So the United Kingdom or the United States especially the United States, they will ask your opinion, right? They really would like to hear about your opinion. But in mainland China, it's a little bit different because they more likely to want you to listen to them rather than to ask the questions. So the culture is a little bit different, but they have advantage. They do faster because when you listen, you just need to do it. You don't need to think about anything else, right? But if you ask a question, that means they have to fix the problem later on. So that's why the training, the PhD, for example, the PhD training or the research training in mainland China is a bit different from the United States or the United Kingdom, because in the European country, or we call it Western countries, they're more likely want you to think about the question by yourself. Would like to give you the time to fix the problem by yourself. But in mainland China or in other Chinese society, they're more likely to want you to follow the instructions and to do it immediately, likely to give them in the morning of the next day, right? So there's a different culture in different countries, but I don't think that is not a good thing. If we can merge the two systems together, for example, at the same time, so in my group is a bit mixed culture between the Western country and the Chinese society. So in my team, my student, I will give them a lot of opportunity to think about why. It's in the Western country, but at the same time, I need my student to give me the answer in the morning of the next day. So you do it at the same time, so the student can be trained how to fix a problem by themselves, but at the same time, they have a very effective work output, and they can find a very good job later on, because as you know that in this competitive society, so if you don't have any solid outcomes, it's very difficult to find a good job. So if you can, for example, as academia, they want to see something like how many papers you publish during your PhD study, or how many papers you publish in your master degree, if you want to search for the opportunity as a PhD candidate. So they will ask you this question. So if you can give them, for example, I have 5 SCI, they call it SCI, so it's something like peer-reviewed academic papers as a first offer, they will think about you are, okay, you're a good candidate, right? But you will say that, okay, I graduate from Oxford University, but I don't have any paper. So they will, nowadays, they will think about maybe later on, or you can do a postdoc first, or something like that. So so now it's more competitive than the past. So we have to also need my student to have a very solid things to show the reviewer, or so their boss about they can do it. Not only can talk about this, they can really can finish this work, because they have the solid evidence to show their ability. So I'm now doing these things, so mixed the Chinese culture and also the Western culture. So my student is quite tough.
So they think outside the box, but they finish their task immediately and on time.
Yeah.
Well, as you have experience interviewing students or selecting students or candidates for a job or practicum or any other numerous projects that you have. So when you interview the candidate for your team, what qualities stand out? How do you select? The competition is fierce. Everybody has really good backgrounds, and how do you select the best one?
Okay, so in my team, for my perspective to select the candidates, I do 2 steps. The first step is called self-selections. Do you heard about this? What is self-selection? So self-selection is something like I will write down a very tough criteria in the post. For example, you have to work 24 hours per day or something like that. So it's very tough regulation or very tough criteria that you seldom to achieve if you don't want to try. Okay, so I will. This is a self-selection. So I will say something very tough. So if you still want to come, and then so I already have a first selection, because some of the very lazy students already think about, okay, Professor Ming is a tough person. I don't want to follow him. So this is the first step. So at the same. There is the same idea that the Harvard University select the candidates. So most of the students are not trying to apply. They are qualified, but they're not trying to apply because they think that Harvard University, they cannot go to Harvard University for study. So that is the first, we call it self-selections. So the second step is the interviews. So I will try to think about the motivation why they come to my group. So I will ask, what is the reason they come to my group? Because as a Pedicom site or the boss in the company, we want to make sure that our thoughts is the same. So for example, you want to get something and I can provide something for you. And I want to get something and you can provide something to you. So it's fair. Okay. So in the interview, I will try to ask what they want to get during the practical. For example, some student want some research paper as a first offer, or some student would like to learn the statistic software. So if I know about this, I will try to provide this training for him or for her, right? So I will also talk about my expectations. For example, I want some student would like to really involve in the project, not only participate, maybe sometime even in charge of the project. So I would tell them about, okay, you have to, because you are the master's student, you have to in charge of a project. In terms of the research design, research methodologies, and also some other, for example, the manuscript, statistic. So I will tell them my expectation. So if you both agree with that, and that pattern should be success, because what they want, I can give them, and what I want, and they can give me. So that is a more fair and also more healthy relationship between the mentor and mentee.
True. And then I guess I have two questions here. Do you think the practicum sort of like is a test for students to, like, you would see, okay, if we work well together, maybe I can offer a job afterwards, or is it's just for the purpose of practicum?
Yeah, usually you don't have any limitation of the candidates. So it could be something like what you mentioned earlier today. So it's something like an interview or something like a trial. Can they become a staff of my research team or of my company? Yes, definitely yes. So I do think that all the Pedicom sites, they want to search some candidates that could become their staff in the future. I do think that most, but some government related section, they cannot do it because they have the normal process of the interviews or jobs posts or something like that. They have some regulation, but in most of the private company or some research teams, they usually will do that. So if you come to my group around 3 months or half years, your performance is good, the professor will really like you to stay in the research group. So in my experience, in my past, I mentor around 80 students in different universities, including the university in Australia and also MIT. I also mentor the students, and all of the students will stay in, not all, maybe 80% of students will still stay in my research team after they finish their practicum. So they will continue to do some research in my team and also publish the paper after the practicum later on. So that depends on different teams, but in my team, yes, we will continue this relationship for a long time.
That's an amazing opportunity, I must say. And going back to the first question again, when you receive, let's say, piles and piles of resumes, so many candidates to look at, what really stands out? Like, how can you pick those top 5 to interview?
So the first step usually is take a look at the educational background. So it is definitely the social impact, because if you take a look at something like the ranking of the university, it will represent a little bit thing about the person. So that's why we have to select Hong Kong U rather than other university. So with Hong Kong, you have a good reputation. So a good reputation student, university will recruit good students into their program. So that is the selection from the university. Usually, the company or the company will consider about that, because it's the most effective way, the most cost-effective way to select the candidates. So that's why the student from Harvard University, they will easily to get a job, right? Because although maybe some of the students not good, right? But the reputation of a university represents something. So usually we will take a look of the educational background, and after that, so if you pass the basic requirement, for example, at least you are from Hong Kong U, and then that's fine. So no matter how long you study in Hong Kong, you already passed the minimum requirement for my screening, right? So after that, I will take a look of the experience. So what is the experience mean? So including the experience to become the student leaders, and also the experience in the something like Practicum and also other company experience. So that's why for almost all the graduate from the MPH, not the local student, they will have some problem on that. If they do not have the Practicum, they will have the problem. And most of the company will ask, do you have any work experience in Hong Kong? So you never can answer any question if you don't have the Practicum. Oh no, I don't. Right. So and they will consider as negative things. So okay, you don't understand Hong Kong, and maybe I can find someone else, right? So the reason why I do think that Practicum is very important, because you already get some local work experience. Although it's not really like a work, because sometimes you cannot work as really the real staff in the company, because you just come here for 3 months or 4 months or 6 months, and also you have some time in the university for lecture. So they will, some company will consider you as a staff, but some company are not, so it depends. So I do think that Practicum is very important for all the student, non-local student, when they find the first job in Hong Kong. Okay. So the second step, I will take a look at the experience. So and this is a little bit different from company to company. For example, myself, I will highly appreciate someone who are the student leader in the university. For example, they are the chairman of the student union, or they are the chairperson of the something like Women's Society. So this, I will highly value these kinds of candidates, because I want someone follow me with this ability. Because as you know, that as a research team, you have to develop a research, and also some research assistant will follow you. So you have to some management skills. So I really want someone who have some leadership skills during the university and also after the university. Okay, but in some team they don't want, as I mentioned, because some professors do not have management skills, so they don't want someone have right? They want someone to just listen to them. So for that teams, they don't want the student leader to follow. So this depends. So different person have some different personality. So that's why for myself, when I apply for the school of Harvard and Oxford, it's very easy. When I apply for other school, it's so difficult, because they think that they don't want the candidate like me. It's very interesting thing. It's really interesting thing. So when I apply some university which is lower ranking, they just think about I'm not qualified.
Interesting that you think that some of your advantages like leadership skills can go actually against you in the recruitment process. Well, thank you for sharing, Wai-kit. It's all very insightful and very useful, and your background is just astonishing, I must say. Well, I think we have this time right now to jump into Q&A, so I'll have my colleague Myra Chang to take over from here to give an opportunity for students. Thank you again.
Thank you.
All right, thank you so much, Dr. Wai-kit, for your time and sharing about your career. Indeed, it's so varied and so fascinating. So I think students have a lot to learn from you. And so for students, there's a Q&A session panel below. So we invite you to submit your questions. But so far, we have some questions that have been sent directly to me. So please just send it through the Q&A section, and we will be more than happy to pose it to Dr. Wai-kit. So Dr. Wai-kit, we have a few questions. So the first one is, you are constantly working with diverse stakeholders and across cultures. What are some key skills and character traits one should have that are crucial for navigating these varied contexts?
For myself, I cannot give you the answer, but for myself, I just can give some experience for myself. So actually, I do think that in multicultural conditions. For example, in the working environment, the most important thing is how you accept the different kinds of cultural differences. Okay, for example, when you work in some area in the United Kingdom and you don't need to expect they can give you something on the next day morning, right? They usually will give you the email and answer maybe a week later, right? So when you work with different people, the first step is you understand the cultural differences, right? So you have to understand it. So and after that, you have to make sure that you have a well communication with all the people inside your group, and also know about their expectation. So as I mentioned earlier today, so when you know about the expectation of different persons, you can manage it better, because different persons have their own expectation. For example, someone wants to learn something from you, and someone wants to get some papers as an outcome, and someone wants to get a salary and don't want to work anything, right? So everyone have different expectations. So you have to manage different expectation as a leader. But if you are the worker, not the leaders, right? So in another post. So in most of my time, I'm the worker, I'm not the leader, right? So when I'm just a worker inside the team, so I will try to think about how I can provide to the company or to the team, because even I don't do anything, I still in the team. So why not to do something for your team? And if your performance is good, you can get a lot of opportunity after even you leave this company. So I do think that I will encourage every student try your best during your working time in your team, because you can learn something from the seniors. You can also provide some insight to the teams. And maybe later on, after 20 years, you'll find, okay, your document still inside the company, right? So it's your contribution, right? So you can talk to your son, okay, my work is still using after 20 years, right? So I also find this issue during my lifetime. So something like when I do something in the university as an undergraduate student, and the document still now inside Jinan University. So I will think about, okay, so I really do some contribution to that, to that university or company. So I think that is the things we can do together, and also have to accept different cultural difference, and you don't have any conflict with that.
Great, thanks so much. Great. Okay, thank you so much, Dr. Wai-kit, for sharing your insights. And so next question is, based on your experiences working in both academic and private sector, so more like academia and private sector, how do you think your academic background contributes to your work in, let's say, starting a company and contributing on that front? And how is the nature of the work different working in private sector versus academia?
Okay, so I do have to mention one more thing before I answer this question. Academia is now more and more difficult than ever. So if you don't prepare well, don't try to get involved in the academia as your career planning. Because academia nowadays, you have to spend a long time in terms of doing your PhD program, postdoctoral training, and also to search for the something like the professorship later on. Now it's more and more competitive. So it's very difficult for students directly to go to the university as a professor after they get a PhD degree. So now the requirement is more than before. Because for example, in the past, maybe you just have 1 to 2 papers, you can be the assistant professor. But now they even need you have maybe over 20 papers or 40 papers, or before you become the assistant professor, you have to do the RAP, the research assistant professor, for 2-4 years or something like that. So which is a bit different from the past. So if you don't try to think about it become your lifelong career, I don't encourage anyone to get involved in these top career pathway. Okay, but this one is really helpful for my entrepreneurship experience, because in most of the high technology companies, the problem is the company do not understand the technique so well. So if you can have a postgraduate training or a Master of Public Health training before you become the manager of the company, it will be great because you can find someone, although you don't know something, you can find someone in the team. For example, in our MPH program in Hong Kong U, so someone is from the clinical background, someone from the economic background, someone from other aspects, maybe the nurse or something like that. So actually you can find someone to help you to understand the product, right? So when you want to invest a medical device company, so you can find someone to help you, okay, to understand whether this technology is true or not. Because as you know that nowadays we have a lot of different product every day. So someone work, something do not work, right? So I do think that our program, the Master of Public Health program, provide two things for you. The first one is provide alumni network, also the classmate network, which is very helpful for you to understand more about that technology. The second one is the skills of interpret the research papers. For example, you know what is p-value, what is less than 0.05 magic number, and also some other, for example, whether the research methodology is correct or not, because someone maybe show you the data only for 5%, they think that this product is great, right? But when we do our Master of Public Health program, we do think that 5 is not a good research population, so maybe not represent the whole population, right? So these kinds of things you have already learned from the epidemiology course and also research methods course in the MPH program. So this one will be very helpful for you when you do your entrepreneurship, because you know who are telling the truth for you and who are lying on you. So that one is I do think that is very helpful for me to start my company. And the third thing is become academia, you will have more opportunity to do some basic and fundamental research, so you can know more the latest information. So when you do your medical technology company or some other company, you will have we call it the barrier between you and others. So something like that, if someone want to copy or someone want to try to do something similar to you, they need to around 3 to 4 years to follow your step. But so that is the advantage for you, because you know this earlier than others. So you can have some advantage. We call it the barrier of someone to copy your things. So you will have a longer time. So that one is I want to mention in this section.
Great, thanks, Dr. Wai-kit. I think from you having a varied background, I do think that these are really valuable insights for us. And so since starting from your MPH to your current work, what do you think has been the biggest lesson so far up to this point?
Although because always the sharing is searching for some so-called successful person to do some sharing. So I do think that later on we can find someone who are not successful to share the unsuccessful story to all of the students, because in my lifetime, actually, maybe 80% is not successful, but only 20% is successful, because we have to learn something from the failure, right? So at the beginning, I do not know how to write a research, for example, research paper. So you can see when I mentioned in the introduction of myself, maybe I have 50 papers, many in Q1 and Q2, right? But actually at the beginning of my academia career, I don't have any papers. I do not know how to write the papers, and even get a lot of rejection from the journal, right? They said that, okay, your paper is not good, and this paper is not valuable to the society or medical field. So I also facing a lot of this failure. So this is the lesson for me is don't think that the failure is not good for you, but it's a kind of a step to get the success. So I still remember at the time point I finished my PhD program, I don't have any paper. At that time, it's zero. So everyone said that, okay, Ming, you don't know how to write paper, you will not have any success in the academia. right? But I try to learn something from the failure. Okay, maybe the research method is not as good as others. Maybe I have to go to somewhere to get more training on my research skills. So that's why at the time point, I select to go to the Oxford University and Harvard University for my postdoctoral training. So after that, I know what is the research skills in this top university, how to publish a good ranking journal. So a little bit different from other journals. It really have some skills. So I learned how to publish this, and after that I come back to China. So I'm quite lucky to have a lot of students to help me, and we publish some papers after that.
Wow, thank you so much for sharing such an honest reflection of your success so far. And definitely success comes with a lot of challenges, and learning how to overcome these challenges is a big part of building up your career. And so thank you so much. I think we're actually reaching the end of our time. Do we have any more time for one more question, Rima, or do you think?
Yeah, we have 5 minutes, so we have time for one question. Okay. Yes.
So we have another question for you, just because there's a lot of students here that have medical backgrounds as well. And so there's a lot of overlaps between clinical medicine and also working in the field of public health. What do you think are the key differences and similarities working in these similar but different fields?
So I do think that the public health is a very important issue in clinical medicines. So if you are the doctor in other part of the world, for example, in mainland China or in other countries, so when you go back to your clinical work, I do think that you can publish or you can do more public health related research. For example, the cost effectiveness of different treatments, or something like the guidelines research, because all the doctors need to follow the guidelines, and public health research is going to draft the guidelines. So you can do something good for your field. So I do think that during your practice, you can collect the data from the clinical setting, for example, from your patient. Of course, you have to get the ethical approval before you collect the information. So after you collect or establish your your cohort in your field, and you can publish a lot of papers later on, which will be helpful for you, yourself, your career, as well as the patient, because the patient will get more high quality treatment after your research. So I do think that they are crossover and very important to use some public health mindset in the clinical research.
Great. So that concludes all the questions we've received so far. So I'll pass this time back to Rima, and before doing so, thank you so much, Dr. Wai-kit, for coming.
Thank you, Myra. And we've reached, this is the time to wrap up. And I just wanted to say thank you again for this time. And we've learned so many things about the careers in public health, about your background, and about practicum opportunities. So hopefully students will apply and you'll be able to find great candidates for the practicum at your job. So thank you so much again, and students are saying thank you, a lot of useful tips. So yes, we will be in touch.
Thank you.
Thank you. Have a wonderful day.
Thank you so much.